Well, good morning, everyone. Welcome to the first ever Active Physical Therapy Zoomcast. My name is Ryan Lowery. I'm an athletic trainer at the Marquette location. And with me, I have JJ Sadler, who's a physical therapist at our downtown location. Welcome, JJ. Good morning.
Good morning. It's good to be with you.
Yeah, awesome. Thanks so much for joining me. It's an interesting time that we're living in, isn't it?
Yes, yeah. I'm counting my blessings every day. Just if I see the sun, it's a good day.
Yeah, absolutely. Well, 2020 will definitely be one to remember. And what we're trying to do here, it's interesting trying to navigate these waters of what life looked like before, what it looks like now, and what life looks like afterwards. And so one of the things that we want to do here at Active is to find new ways to add value to the lives of our patients. And so some of the things that we've been doing have been a lot more digitally focused, right? And so this idea just kind of came up out of the thought to continue to educate and continue to encourage our patients, even though we can't be there face to face. So the thought is, hey, let's get together a couple of clinicians and chat about something that we're passionate about, just like we're two people chatting over coffee. And the hope is that the patients get something out of it, right? So the topic that we're going to talk about today is back pain. I think it's a very, very relevant topic. Virtually everybody in the world has some sort of back pain, or at least most people do, right? Something that you and I see all too often. So it'll be an exciting topic. And again, the hope is that the people out there get something new and exciting out of this. So, but before we start, I would like to give our audience just a chance to get to know you a little bit. So why don't you just start by talking a little bit about yourself? And I'm really interested to hear how you got into physical therapy in the first place. Why did you decide to become a PT?
Yeah, so I'll start from the beginning. Basically, born and raised in Munising, Michigan. Pretty active in sports. Wrestling was the big one for me. And then from Munising, I ventured out into to Alma College. I did wrestle there. It's I went there to wrestle, which isn't always the best thing to go to a college just to do sports. But fortunately for me, the program there, the wrestling program was quite good, but they also had a very good integrated physiology and health sciences degree. And the program there was pretty good. And I just had basically a longing, or I was really interested in the human body and how it works and how I can make my body work better, the different exercises and programs that I could do to exceed and excel in wrestling. And I'm pretty competitive as well, so it was good to get to play out that competitive drive. But in regards to getting to physical therapy and how I became a physical therapist, when I was in high school, I started a job at the local Radio Shack here in Munising. I did a lot of technical stuff, and it was just kind of like helping tourists and locals deal with like cell phones, cameras, chargers, etc., computer things and TVs. And I found that I had a love to just converse and talk with those people, and it felt really good to help them in some form or fashion. And then so we fast forward to Alma College, and I'm wrestling. And I'm still, I'm going down that physiology background, trying to look at a way like what profession can I do to help people and utilize those people skills that I have. And so I got injured a couple of times during my wrestling career at Alma. And so I spent a lot of time in the athletic training atmosphere. And then that kind of piqued my interest into physical therapy because previously it was pretty limited in terms of what I knew was out there in the healthcare field. And then as I shadowed a couple physical therapists, I really realized that I could utilize my passion for health and exercise science and combine that with the people skills and the longing to help people. So I kind of really started getting engaged in physical therapy and figuring out ways that I could go down that path. And then so I went to Wheeling Jesuit University. I took a little gap year. applied to Wheeling Jesuit down in Wheeling, West Virginia, and then went there for my doctorates. And then my love for the Upper Peninsula called me back where I accepted a position with Active.
Awesome. Awesome. Well, that's really exciting. You know, when your passion and your talent intersect, right? Like there's truly nothing like it when you find it in a career path. I'm really excited to know that you're a grappler. I do Brazilian jiu-jitsu, you know, so wrestling and grappling is something that's really exciting to me as well. And it makes perfect sense. You know, it's kind of neat too, how you can kind of nerd out on the biomechanics of timing and leverage and, you know, in
right.
your sport.
Yeah.
You know,
it's interesting because when we were just talking about different techniques of manual therapy and stuff, you know, it was like something I lived in that world, because with wrestling, you know, you got to find the best way, the best biomechanics to make a move work. And it's the same thing with physical therapy. So
yeah, that's exciting. Very, very good. Well, talk a little bit about your clinical interests. I mean, you know, when you and I were talking about setting this up, you said, you know, hey, I really love working with the back. It's one of my strengths, which is kind of unique, I think, in physical therapy, right? Because, you know, when I was kind of starting off early in athletic training, working a little bit in physical therapy as well, it seemed to me that like nobody wanted to treat backs, right? You know, so it's unique to find people that are like, yeah, backs, give them to me. So tell me a little bit more about that.
Well, yeah, so my last clinical instructor, he taught a lot of continuing educations in regards to treating the neck and the lower back. And again, he came from a wrestling background, heavy in manual therapy, which is something I love just because you get to put a hands on someone. And I think it's a very intimate, and it builds a good bond with the patient, and you see good success with that. But because I was so embraced in that atmosphere of working with neck pain and back pain patients, I mean, we had a lot of other patients that we were working with, but it was something that I saw regularly and often. And it was really fun to get to see those patients and see success with them. So when you see the success that other clinicians are able to have with back pain patients, it's really encouraging. And so that's just kind of why I've really found the back and neck pain patients to be a real fun patient population.
Yeah, it is kind of fun and interesting as well when you're able to treat something and treat well, something that not a lot of other people are able to, right? Or something that other people are like, no, I don't want to deal with that. That's too hard for me, right? So, and they send them to you, and you do great with them, you know. So that's very, very satisfying as a clinician. Well, let's kind of talk a little bit. Let's dissect back pain a little bit. What are some of the most common reasons that you find in your practice that people have back pain?
Yeah, so just initially, I like to talk about, I mean, when we think about any joint in itself, we look at the knee, the shoulder, etc. The back has the same the same players that are there. And that's going to be, it just has more joints that are around the area. So you're going to have potential for a joint in itself to have pain, the ligaments in themselves, or the muscles themselves to have pain. So those are all key players, and even nerves themselves, obviously, they're responsible for the pain. But when we think about back pain in itself, the common players that people hear about are going to be your disc herniation. So you herniate the disc. The disc, we call it sequestration. It protrudes and it impinges a nerve, so you might get your symptoms of numbness and tingling. And then you got like spinal stenosis, where that bony canal around your spinal cord kind of decreases, or like the bone growth, and it impinges on that spinal cord there, or nerves when they run through. There's some facet joints, but the common thing that I'm seeing with back pain and common reasons is pretty much due to movement faults. So we know that like if we're not moving properly, or we're adding load and then undue or increased stress to a tissue, we're going to cause pain and injury to that area. And oftentimes that's what happens, or it leads up to that disc herniation itself. You put some undue stress in the lower back area. Say you lift a heavy object with bad posture, you're bent over instead of keeping your back straight and bending at the hips, that's going to cause that disc herniation and set you up. And so really the other thing too is the lumbar spine or the lower back is supposed to be for stability, and we're supposed to use, and then if you look at your like shoulders and hips, those are primarily used for mobility. They're going to help you get from place to place or grab those objects, grab things and move the body, where this lower back is for stability. And if we start to compensate because we have issues in the hips, so say we have a lack of mobility in the hips, we might go and try to get more mobility in the lower back. But by doing that, we're going to set ourselves up for some serious problems.
Yeah. Yeah, absolutely. And I would agree. I think that's, it seems to be no matter what the issue is, you can often find a movement dysfunction somewhere that's contributing to, especially like you say, low back pain, right? They're weak in the core, or they're immobile through the thoracic spine because they're sitting, at a desk or at their phone all day, right? And it definitely affects other areas. What about misconceptions? What do you hear patients saying that you find yourself having to educate heavily on in regards to back pain?
Yeah, so I just read some recent literature, and it was interesting. They surveyed 1,200 patients that had acute low back pain, and what they found after reviewing those cases of the patients that said they had lower back pain, that less than 1% of them had pain due to significant damage in their lower back. So what is the significant damage? We're talking about like a fracture, infection, cancer, something along those lines. So the fact, I think sometimes patients get really overwhelmed by the fact that they're having pain, and if they're having pain, there must be something very serious going on in my lower back. But with those statistics and seeing that less than 1% of those 1,200 patients, I mean, there is going to be some patients that have some serious structural issues, but I think for the most part, those fears are you're okay in that structurally in the lower back. And just because you're having pain doesn't mean that you're structurally having some serious problems. The other one that I hear a lot is about disc degeneration. I don't want to go too far down that road, but I just want to say that disc degeneration isn't abnormal. We all have some form of disc degeneration in our lower back. Exactly. And so with the years, if you're a teenager, that's when that disc is going to be at its best. And then as the years progress, basically the blood flow that goes to the disc with time is going to diminish. The amount of water that disc is able to hold in the lower back will diminish. And so if we're looking at an MRI through over time, as I age and you age, Ryan, we're going to see that our discs are going to degenerate, but that's just because of normal aging. However, I mean, there are cases where patients do have the disc degeneration, but just know that that can be a normal process.
Yeah, 100%. And you know what I find myself telling patients a lot is tissues heal, right? Even if there's an injury, tissues heal. You can get better. Even if you've been told you have disc degeneration, there are things that we can do to help restore movement, restore function, get pain to go away. I think one of the most common misconceptions that I hear is that people like truly believe that I have a bad back and I'm going to have a bad back for the rest of my life. There's nothing I can do about it. It's only going to get worse. And then you start kind of going down this road that turns into a chronic pain condition, right? Where they're just always in pain. Anytime, anybody puts a hand on them, they're just super sensitive, And so I think what I'm trying to say is like, there's hope, right? There's hope no matter what. There's hope. You can always improve. Even if your doctor tells you you have the back of a 90-year-old, right?
Yeah.
They shouldn't tell you anyway, right? That's not a nice thing to say, right? But there's hope. You can always improve under guided care, right?
The other one real quick, if I could, that I hear a lot too, is that a disc herniation is always a cause of pain. So there have also been MRI studies looking at people that are around the age of 24 to 26, so my age, and they're walking around and they're doing an MRI of their lower back, and they're having no pain whatsoever. But when they look at their MRIs, they'll actually see that the patient does indeed have a disc herniation. So just because you have a disc herniation doesn't mean that you're going to have pain in your lower back. And then, so you might be saying, okay, JJ, well, okay, I have the disc herniation, but I do indeed have pain in my lower back. Well, the disc herniation itself isn't a death sentence, or it doesn't mean that you have to have lower back pain the rest of your life. We like to talk about that disc as a jelly donut. So if you smash the disc in some form or fashion, the jelly inside that disc, it protrudes, and then it can impinge on that nerve that's going through the lower back, or the nerves that go through the lower back. Well, fortunately for us, a disc isn't truly like a jelly donut, because if you smash a jelly donut, it's never going to take back up its form, correct?
That'd be awful.
Yeah, it just won't do it. But in human beings with our discs, that sequestration, or the jelly portion that has protruded out, with time and added exercise, we can get that jelly part of the disc to go back into the disc. So it's not a death sentence. It's something with time that we can get under check and alleviate the pain.
Yeah. Yeah, that sounds awesome. I mean, I'm sure there's a lot of people out there that have been told, the big scary word, disc bulge, disc herniation, that may have just heard that and said, okay, maybe I've got some hope here, right? So that's great language, I think. It doesn't have to be a death sentence. When someone comes to see you with back pain, talk to me a little bit about your approach. Where do you start, and how do you kind of talk to me about your I mean, I know every patient's a little bit different, right? But what's your approach in general to treating the low back, or the spine in general, I guess?
Yeah, so it's pretty similar to like anyone at active, what you would get. But essentially, we do a thorough examination. So I'm trying to pinpoint or come up with some potential reasons as to why you might be having back pain in the lower back. And then once I can get an idea of why I think you're having some of that pain, then I like to educate you on back pain itself. And then we'll try to find potential triggers that's setting you up for that back pain, and then give you ways to alleviate those triggers. So that might be, postures that you're holding that are improper or not good, or that might be different movements that you're doing throughout the day that are setting you up for that pain. And then I'm going to give you some movement strategies or ideas as to how to move without pain. And we want to try to find those pain-free movements so you can get back to going through your activities of daily living without having pain. But initially, after I pinpoint some of that and we talk about the education, I utilize what's called, what we're going to do, like a manual therapy approach along with supplemented exercises. So the research, from what I'm seeing on my end, the literature supports that manual therapy plus exercise, you're seeing better patient outcomes when you supplement them together, as opposed to just doing one or the other. So manual therapy alone or exercise alone. So we combine those two to help the patient there.
So for those out there that don't understand, talk to the audience about what manual therapy is. Give some examples.
Yeah, so it's kind of a hands-on approach. Some of the things that I like to do, one is called the muscle energy technique. And so that's where I utilize the patient's muscles to help reset the neuromuscular system. So oftentimes in that lower back region, when you've got an irritation, those muscles are all spasmed and really irritated to protect that lower back. But what can happen is that those muscles continue to spasm. And so I kind of call it like a neuromuscular reset in a way. We're trying to get your body to relax the muscles in the area, and then get the structures back in the way we want them to be. And then we're going to supplement with exercises to keep everything relaxed and then stabilize that core.
Yeah. Yeah, I love manual therapy. Early on in my career, I discovered the power of hands-on touch, right? Like putting hands on your patient, getting them to relax, getting them to actually if I can get my patient, especially on that first visit, right? If that first time I see the patient, if I can get them feeling better walking out the door, than when they came in, even if it was just a little bit, and I can use some hands-on techniques to do that. Man, that's one of my favorite things to do, because it's just incredibly powerful, not only for pain reduction, but also for, like you're saying, muscle relaxation, so that you can like really get down to the nitty gritty of what actually needs to be done, right? Like a lot of times the spasm is kind of a secondary issue to what's really going on. And so
Right.
you
Yeah.
have somebody who's just always walking around super rigid because their low back hurts and they can't bend over to do anything, and they're just splinting all the time. You know, a lot of times I've just found step one is to just get those muscles to chill out a little bit. And so I'm just a huge fan of manual hands-on therapy. Anything else that you want to say about your approach?
Yeah, so then after we go from the manual therapy, we talk about the targeted exercise. So we already spoke about how in the lower lumbar region, we're talking about stability, where the hips and the shoulders are about mobility. So when I think about exercise, the stability, the best way to get to that stability of the lower back is to target the core. And so if you kind of think about your lower back or the spine as a kind of like let's say like a Verizon satellite tower. You've got wires that go up and grab that tower there. So that's kind of structurally what's happening. Those muscles of that core, they provide the stability for that satellite tower. And then the satellites on top of the tower, that's your mobility portion. That can be your hips and your shoulders. So first, I'm trying to get those wires to be supple and have a little bit of ability to bend, but the stability and the strength to hold your satellite tower in place or your lower back. And then if we're having some issues with hip mobility that's causing us to gain mobility in the lower back region, then I also address the hips in order to get more mobility through there, so then we can maintain the stability of the lower back. So it's kind of just some targeted exercise along with the manual therapy as well.
So it sounds like what you're saying is that oftentimes there's way more going on than just the lower back. You're looking at the back, you're looking at the shoulders, the hips, sometimes even the knees and the ankles, right? I mean, it depends on what's going on, but I think it's important for people to understand that this a lot of times is just way bigger than your low back, right? And so we try to address all those areas if and when we can, right?
Yep.
Well, we're just about out of time. Are there any little nuggets, anything, if you could pick one thing that you would want our listeners to know about back pain, what would you say?
Well, first, if you are struggling with back pain, again, it's not something that you have to live with the rest of your life. And if you've struggled with it in the past, I would say definitely give Active a call and get in contact with a physical therapist and let us deal and help you in your path to getting that low back pain situation taken care of. And then secondly, I'd just like to talk about a few resources that I think would be helpful during this period of time if you're interested in learning more about the lower back and back pain itself. So the first resource is you can find on YouTube. His name is Adrian Lowe, ADRIANLOUW, and he has some very good information on educating patients about chronic lower back pain and how it works in the brain and itself, just pain in general. So that's a really good one. And then secondly, there's a professor of emeritus out of Waterloo University in Canada. His name is Stuart McGill, and he has a book that is called Back Mechanic, and his book is exceptional. It's a book tailored to laymen's or people that aren't really familiar with lower back pain and how everything works. And I'm reading it right now, and as a physical therapist, I find it super helpful. So if you are in that category and are interested, I would definitely check out those resources for some additional information.
Amazing. Yeah, we'll definitely put some links in the comments so that people can reach those resources if they're interested. Well, JJ, thank you so much for your time. This was incredibly informative, and I hope our patients got a lot out of it. I hope you have a great day and enjoy your time.
Yeah, you too. It was my pleasure to be here.
All right, take care.